And I now call to move the main motion Daisy Cooper, MP for St Albans and the party spokesperson on health.
Good morning, conference. Gosh, you're sleepy, aren't you? That's more like it. Our country is fighting a losing battle against ill health, and the NHS is unable to take the strain. We've all seen the stories about how hard it is to see a GP or a dentist, and we've seen the horrifying images of people dying in the back of ambulances because our NHS services are overstretched. But what often goes unnoticed is that many of the public health programmes that have helped people lead healthier lives have, under the Conservatives, been completely gutted. Services to help people quit smoking, children's health and sexual health services have been slashed. Other initiatives, such as those aimed at tackling obesity, have been pared back. Since 2015, the Conservatives have slashed the public health grant by 26%. They even reserved the biggest cuts for the most deprived areas. These cuts to local community health grants underline the absurdity of the government's claim to be levelling up when people's health is in fact being levelled down. Conference, unless we get to grips with the prevention agenda, we are doing nothing to defuse the ticking time bomb facing our NHS. Helping people stay healthier is not only good for people, but it allows the NHS to see people far quicker and ensures they don't end up in hospitals in the first place. What the Conservatives cannot seem to understand is that taking action and investing now will save us billions in taxpayers' money down the line. £1 spent today on health interventions is £14 returned to the economy in the future through healthy years lived and a reduction in the cost to the NHS. It sounds like doom and gloom, doesn't it, conference? But I do have good news for you. The Liberal Democrats do understand this, and we are committed to investing now to save in the future. That's why this motion today commits our party to restoring the public health grant. We'd progressively bring it back to where it was in 2015 so that local authorities can get back to doing great work in local communities and helping people lead healthier lives. And we won't stop there. The measures in this motion set out our plan to help people to take charge of their health and make our country a healthier place to live. One of the measures in this motion simply commits us to going ahead with a pledge that the government has already U-turned on, like ending the sale of energy drinks to children. Despite the Conservatives' backtracking, Tesco, Morrisons and Asda have led the way, and they are now voluntarily ending the sale of energy drinks to children, but not all convenience stores have. The motion commits us to giving local authorities the power to ensure that no new unhealthy fast food shops are set up near schools and nurseries, and to control advertising for unhealthy foods so that children aren't constantly bombarded with adverts for that junk food. We'd also improve the food standards in schools and hospitals, as well as consult on a new national designation of critical health infrastructure for swimming pools and leisure centres, so that the next time the Conservatives have a mini budget and crash our economy, people around the country don't have to see their health and fitness facilities slashed. Now, some may question why Liberals are calling for these measures. Well, it's easy. We're not libertarians. We don't want to minimise government's role come what may just for the sake of it. We're Liberals. And we believe that an active state should intervene when there are structural inequalities or power imbalances which themselves restrict people's freedom. We didn't accuse this government of meddling when they promoted the vaccine rollout. In fact, it was quite the opposite. Our communities took great pride in working side by side with GPs, nurses, NHS staff and other volunteers to get people jabbed and to give them back their freedom. And we loved the profound sense of community that effort generated. We all said we wished that we had more of it, not less. So imagine using one of our existing bank holidays to get our nation moving again, engaging new people in park runs, music and movement classes, gentle stretching, healthy cook classes, an injection of community effort to encourage people to voluntarily adopt healthier habits. Now, Conference, there are 2 amendments and a separate vote to this motion. Amendment 1 calls for the motion to go further on health checks and the rollout of health clinics in more public spaces. I am very happy to support this amendment, and I hope that you will vote for it. However, I encourage you to vote against Amendment 2, and in the separate vote on lines closing loopholes in the sugar tax, please vote to keep the lines on the sugar tax, not to delete them. Firstly, Amendment 2 would, on the one hand, dilute our stance on single-use vapes, but on the other, would also make our stance on vape advertising too strict. Single-use vapes are overwhelmingly targeted at children. The nicotine in these vapes can impact brain development, and they are a complete blight on our environment. Other measures can only go so far, and the quickest, simplest way to reduce harm to children and to the environment is to ban them. Even this useless government has realised that single-use vapes need to be banned. So I call on you to vote against Amendment 2. Up for a separate vote is the removal of our commitment to extending the sugar tax. I strongly implore you to vote to retain the lines in the motion that commit us to this policy. The sugar tax has been an overwhelming success. There's no 2 ways about it. Prices for sugary drinks have stayed the same. They have not gone up, and the amount of sugar in them has been vastly reduced. Conference, I encourage you to retain the lines as they stand in the motion. As a party, we pride ourselves on having evidence-based policy, and this attempt to remove our commitment to the sugar tax is not based on the latest evidence or studies, so you should reject it. Conference, a responsible government cannot just stand idly by and shrug its shoulders, leaving its citizens to navigate an increasingly unhealthy environment. If we do, our population will be ill, our economy will remain flatlined, and our NHS will be overwhelmed. In short, doing nothing is not an option. Let's commit the Liberal Democrats to creating a country that is healthy for children and adults alike, a country that takes the well-being of its citizens seriously and empowers them to live healthier lives, and to recognise that there is a role for an active state in enabling them to do so. Conference, I ask you to vote against Amendment 2, to retain the lines in the separate vote, and then finally to vote for the motion as a whole. Thank you.
Thank you very much, Daisy.